Let's take a look at the state's COVID-19 vaccination rates tonight. 68% of Virginians have received at least one dose of the vaccine. Nearly 59% are now fully vaccinated. But these numbers look very different when you break them down based on race and ethnicity. Just over 62.5% of white Virginians have received at least one dose of the vaccine. About 59% of black Virginians and over 78% of Latino Virginians have also gotten at least one shot. Now, if we narrow that number down to focus only on Richmond, the gap widens between blacks and whites. You can see here, Latino Richmonders are just over 7% with one dose. White Richmonders at just over 62% or 61%, almost inching toward 62%, but only 44.7% of black Richmonders have gotten at least one shot. So why is the African American community trailing other races when it comes to getting vaccinated?
Our Leland Pinder has that. That was the topic of a forum at Virginia State University. He joins us now to explain. Leland?
We'll build the conversation this evening featuring medical professionals and community advocates hoping to get to the heart of this issue and encourage higher vaccination rates among Black Americans. An important question and the first of the night.
Would you please speak on the roots of vaccine hesitancy and what can be done to combat this?
The forum opened with a reference to the Tuskegee syphilis study as a reason for African Americans' general skepticism of the government and medical community. Tuskegee was a U.S. government and CDC experiment on the effects of the untreated disease on poor black men between the 1930s and 1970s. Participants were lied to about the nature of the study. Many died and spread the disease to women, who then spread it to children during birth.
As I look at the country's history with black subjects, that's where you see a lot of the roots of hesitancy.
SHAVON ARLINE-BRADLEY, a master of public health, went on to specifically address hesitancy in COVID-19. Her theory: bad messaging, a shaky rollout, and poor explanation of vaccine development.
So there's been research for years about the kinds of vaccines that are out there. But that's not what we heard. We heard warp speed. You heard of that, warp speed? The vaccines are going to be done at warp speed. So I think hesitancy is connected to the lack of messaging and not clear on how this process works.
SABLE Nelson, an attorney and public health policy expert, also says it may have more to do with the here and now and not so much what may have happened decades ago.
There was just a study that was released in the New England Journal of Medicine that said just this year, June of 2021, there was a survey done of hundreds of hospital systems across the country. It showed in just the last 12 months how black people and brown people are being treated differently.
Another example offered by attorney and political commentator Bakari Sellers was the powerful story of Dr. Susan Moore in Indiana. She died from COVID-19 in December 2020 following claims that the doctor treating her was dismissive of her pain and health concerns.
Experts in our own lived experience. And I want to empower each of you all to share your story, own your story, and that's what's going to turn hearts and minds of folks who haven't been vaccinated.